Brown. Here. Russell Legalbear. Elizabeth Whitepipe. Steve Brave.
Here.
Stanley Woodenknife. Vanessa Redhawk Thompson. Here. Michael Lunderman. Fremont Fallis. Tennille Blackfeather.
Here.
Here. William Marshall.
Here.
Wayne Fredericks. Eileen Schott.
Here.
Here. Martha Blue Thunder. Sherry Wright Plank. Norman Running.
Here.
Pam Pilsenwater. Here. Raymond Crowegal.
Here.
Dara Ayat. Donna Hollowhunter.
Here. Here.
Dwight Buttercup. 11 present.
I only had that one contract. Copy that. Another one, yeah. Okay, we have a quorum. Martha, will you do invocation for us, please, this morning? Okay, is there anybody that needs to be excused today for any reason? Steve?
Good morning, council and administration. I'm going to be needing to leave about 2:30.
Okay. Norman?
Mr. Chairman, I'm leaving at 2 o'clock today.
Chairman Donna.
Okay. Go ahead, Donna.
3 p.m. I'm leaving at 3 p.m.
Okay. Okay. Well, I think we'll probably be done by before that. We don't have too much on there, so. Need a motion for approve excuses? Norman, second by Bill, question by Martha. All in favor?
1, 2, 3, 4, 5, 6, 7, 8.
Online, Eileen,
Yes.
Tennille,
Yes.
Donna,
Yes.
11.
opposed?
0.
Not voting?
0.
Motion carried. Okay, we'll get right back on the agenda. Yesterday, we went through resolutions and motions. We're all the way down to social services. Is there any resolutions for social service committee?
Is he looking to?
Yeah, so if there's any resolutions or motions that need to be made for social service business.
Just personnel, land and natural, and health board,
Okay.
and governmental affairs.
I thought we did all that in natural yesterday.
We had one that came back yesterday. Gotta wait on that.
Transportation committee. Ah,
I think I have anything
No,
up
we don't have
there.
anything.
Nothing.
okay.
There goes personnel ones.
Pam, go ahead.
Good morning, Council Administration. Chairman, yesterday, before we adjourned, I advised you of the two resolutions that from our February council meeting, asking the in-house attorney to draft. They're drafted. I don't know which
I
department,
got them here.
I don't know which one or which, place
That's
you want me
for the
to.
request for records.
Yep.
Okay, I got two of them here that need to be passed out to Sergeant.
Are we gonna do those under social services or under transportation?
We can do them now.
Okay, thank you. I guess I'll give a little briefing and while Wayne's in here, because he can help me with explaining it, but in our February council meeting, there was a discussion on records that we could not retrieve from the Bureau. And there was also records down in Kansas City that needed to be retrieved or at least looked through for enrollment purposes. Oh, I have a, and also for some things that may have what else was there, Wayne? There was remember the records? We have two resolutions here. One was to receive the census from the Bureau. And then the other one was for our retrieval of records from Kansas City. But it was mainly had to do with our enrollment.
We're trying to get our original COVID base.
So that was the reason why I had motioned for our in-house attorney to draft these resolutions. So I don't know if they need to go just to our local BIA or if they need to go to the higher up BIA.
You send the superintendent, and she'll send them out.
Okay. So I'll start with the one that has 1, 2, 3, 4, 5 whereases. That's the shorter one.
Okay.
Okay.
Need a motion for emergency legislation.
Motion for emergency legislation.
There's 78,
79?
79. Second by Jordan,
Question
question by Ray. All in favor?
1, 2, 3, 4, 5, 6, 7, 8.
Online, Eileen?
Yes.
Tennille?
Yes.
Donna? Emergency legislation. Opposed? Tennille?
Yes.
10,
Opposed?
0,
Not voting.
1.
Motion to approve resolution 2379.
Need a second? Jordan? Go ahead.
I will start with the fourth whereas. Whereas the Constitution of the Rosebud Sioux Tribe, Article 4, Section 1T, authorizes the Rosebud Sioux Tribal Council to adopt resolutions regulating the procedure of the council itself and other tribal agencies and tribal officials. Whereas the Rosebud Sioux Tribe has passed a motion to request a copy and access to the original census roll of the tribe as of April 1st, 1920, for the purpose of research and preservation of records of the Rosebud Sioux Tribe, stored by the United States Department of Interior, Bureau of Indian Affairs in Kansas City, Missouri. Now therefore be it resolved that the Rosebud Sioux Tribe adopts and approves the motion of the Rosebud Sioux Tribal Council to establish, and appoint a special ad hoc committee to access, research, review, and make recommendations regarding the use, preservation, and storage of the records and information of the Rosebud Sioux Tribe stored in Kansas City, Missouri.
Any discussion?
Do we need to add another, be it resolved, giving you the authority to sign any and all pertinent
Yeah,
documents?
we'll add that. Therefore, be resolved. Finally resolved, or however you would say it. Yeah.
I know that little lingo.
Finally, therefore be it resolved.
Again, be it resolved. We got, Kim, she's gonna add that to that, so.
Okay.
Add another.
As amended.
Any discussion? Steve, question? All in favor?
1, 2, 3, 4, 5, 6, 7, 8.
Online, Eileen?
Yes.
Tennille?
Yes.
Donna?
Yes.
11.
Opposed?
0.
Not voting?
0.
Motion carried.
Motion for emergency legislation.
Number 80, need a second. Jordan, question by Bill. All in favor?
1, 2, 3, 4, 5, 6, 7, 8.
Online, Eileen?
Yes.
Neil?
Yes.
Donna?
Yes.
11.
Opposed?
0.
Not voting?
0.
Motion to approve.
Motion to approve resolution 2380.
Second by Ray. Go ahead.
Let's see, I'll start with the 1, 2, 3, 4, 5th whereas. Whereas in accordance with the Constitution and bylaws of the Rosebud Sioux Tribe, Article 2, Section 2, the tribal council shall have the power to promulgate ordinances covering future membership and the adoption of new members. And whereas on or about September 2007, the United States Department of Interior Bureau of Indian Affairs moved and stored original records and documents of belongings to the Rosebud Sioux Tribe, including the original census roll of the tribe as of April 1, 1920, to Kansas City, Missouri. Whereas Rosebud Sioux Tribe has passed a motion to request a copy and access to the original census roll of the tribe as of April 1st, 1920, for purposes of research and preservation of the records of the Rosebud Sioux Tribe. Now therefore be it resolved that the Rosebud Sioux Tribe hereby requests a copy and access to the original census roll of the tribe as of April 1st, 1920, for purposes of research and preservation of records of the Rosebud Sioux Tribe. Be it further resolved that the President of the Rosebud Sioux Tribe is authorized and directed to contact the U.S. Department of Interior Bureau of Indian Affairs and to sign and execute any and all other necessary and supporting documents.
Okay, is there any discussion? Question, Steve?
Question.
All in favor?
1, 2, 3, 4, 5, 6, 7, 8.
Online, Eileen?
Yes.
Tennille?
Yes.
Donna? Opposed?
0.
Not voting?
1, 10, 0, 1.
Motion carried.
Thank you, Council.
Okay. We have another one that yesterday we were talking about some contracts for our lobbyists, and we had that Dal Lavender and we had Mark Van Norman. I don't have a copy of Dal Lavender's, but I was told that Wayne was supposed to have contacted Dal and Mark and asked them about priorities and put that in their contract. They're supposed to bring it back. So Wayne's here now. I got the copy of Mark's contract and a resolution to approve it, but I don't have Dell's. So does anybody else have Dell's?
The one,
These two are cool. Go ahead, Pam.
yeah, yesterday, the one that Lisa had gotten passed out was the same resolution that we were having a hard time passing from prior. And the reason for it was because in there, one of our colleagues did not like how it was always saying review. There was no kind of specifics on what exactly was going to be done. I think that's what one of my colleagues had requested, was the specifics of it.
Yeah, Yeah, here it is.
Trying to find it.
Has a number. This one's,
They presented it.
So we weren't gonna be able to pass it yesterday because it was the same resolution that had been brought several times for passage. But,
We need to copy.
The
We know.
contract has changed.
the resolution itself, in here, it says, whereas the Rosebud Sioux Tribal Council requires legal and lobbying services on the following matters: realty issues, including fee to trust review and guidance with pending and future applications with the BIA process, review of fee to trust regulations, Indian land consolidation issues, facilitating access to energy resources, boarding school records, and review of U.S. Department of Interior policies. My colleague, Mr. Eaglebear, had an issue with the way the resolution read on nothing but review. He wanted specific things for our lobbyists to do.
That's not marked, but now we'll go back to this one.
You must have taken out that review, the resolution, but I know he meant it his contract.
So while I read in Van Norman's, can you cross out whatever needs reworded or whatever needs to be done, and then we'll amend it whenever we, when I read it into record.
Jordan?
Thank you, good morning. And before you go, I thought the conversation yesterday on Dallas was, I thought Lisa said she was gonna take it back to budget and finance.
No, it was because of the language, and she seen the same thing that I seen, which was, it just said review in there, and that's what, if you remember, Councilman Eaglebear didn't want, I mean, he didn't like that wording, because remember he was saying if it's just review, you could
Right. Okay.
claim 6 hours just to review. So,
Yeah, I see it's still under the same contract here too.
yeah, so I don't know which contract you got with down on and what you,
Yeah, this is the second one, you're supposed to take a review out of there. Can I get with him and change all this language?
yeah, that's fine.
Can I get somebody to, now, Mark Van Norman's yesterday, they had a special contract with it, and I guess all those, the priorities that he was gonna be working on are listed on this contract. Then they have the resolution that was just passed out just to approve his contract. So if I get somebody to bring this on as emergency legislation, we can talk about his contract.
I can bring it on as emergency legislation, I just don't, I would like to see a copy of the contract, I guess.
Okay. Yeah, the contract was passed out. Contract was passed out.
The special council contract.
Yeah.
I didn't get that, I went through, oh,
Okay, there's need a motion to bring it on as emergency legislation. It's gonna be 81.
motion for emergency legislation for
Second by Jordan, question by Ray. All in favor?
1, 2, 3, 4, 5, 6, 7, 8, 9.
Online, Eileen.
Yes.
Tenille. Donna.
Yes.
Levin,
Opposed?
0.
Not voting.
1.
Motion to approve.
motion to approve resolution 2381.
Second by Jordan. Go ahead.
I'm gonna take out that 1, 2, 3, 4, that fifth whereas, take that out, and I'll start with the sixth one. Whereas Ms. Tisty and Mr. Van Norman have provided the Rosebud Sioux Tribe effective representation with Congress, the administration, and federal agencies on the implementation of the CARES Act state, local, tribal government coronavirus relief fund, dismission of the entire 8 billion tribal government set aside to Indian tribes and not to native corporate entities. Application of federally recognized Indian Tribe List Act. Passage and implementation of the American Rescue Plan Act, including the 20 billion tribal government coronavirus relief set aside through the Treasury Department and other funding streams through HHS, BIA, USDA, and other agencies. Participation in the Biden administration government-wide tribal government consultation directives, including submission of comments, advocacy for strong tribal provisions in the administration's jobs and infrastructure plans, fiscal year 2021, interior appropriation hearings and oversight process, including drafting testimony, Senate passage of the 1.9 trillion infrastructure plan and the 3.5 trillion climate initiatives, paid leave, child care, education, and healthcare plan, both through the reconciliation process, congressional and agency meetings, and drafting legislative and policy position for the South Dakota congressional delegation and the administration, among other matters. Whereas the president of the Rosebud Sioux Tribe recommends that Rosebud Sioux Tribal Council renew the special council contract with Shannon R. Aticity Esquire and Mark C. Van Norman Esquire of Aticity Van Norman LLC for calendar years 2023 through 2024 in amount not to exceed $6,000 per month in fees plus authorized expenses from January 1, 2023 through December 31, 2024. Whereas nothing in the special council contract for calendar years 2023 through 2024 between Aticity Van Norman LLC and the Rosebud Sioux Tribe shall be a waiver of the sovereign immunity of the Rosebud Sioux Tribe. Therefore, be it resolved that the Rosebud Sioux Tribal Council agrees to and adopts the recommendation of the President of the Rosebud Sioux Tribe to approve the special council contract for calendar year 2023 with Shannon Aticity Esquire and Mark Van Norman Esquire of Aticity Van Norman LLC for an amount not to exceed $6,000 per month, plus reasonable authorized expenses from January 1, 2023 until December 31, 2024. Be it also resolved that the President of the Rosebud Sioux Tribe or his designee are authorized and directed to execute any documents necessary for this contract.
Okay, I had a request on there for our council as far as his contract. Some of them want us to see a monthly report done and report it back, so we can add that language in his contract, and I'll make sure that happens, okay? We want to do that part of a resolution to say that you would provide monthly reports to us for the resolution, so I don't know where we want to put that at, but
Do we add that inside the contract too?
yeah.
It's not just the resolution?
Both.
Okay.
Can we have Eric look that over and add that as amended?
Yeah.
Okay.
Now, this report, I guess my thing is on these monthly reports, are they gonna be in person or are they gonna be just a written?
I think he got two different places. He's back and forth from DC and I think Phoenix, he's back and forth, so that's two different. I think he's also in Rapid City quite a bit, so I can request it. He doing when he's available.
If he can't be here monthly for monthly reports in person, maybe we could do quarterly.
Okay.
At least quarterly, he'd come here and that way we can ask
The
questions.
Zoom's back up. I'm sure you can get on Zoom, so we can do it that way too, so. Eric?
And just as a suggestion, I think he should file his reports and have them reviewed specifically by Governmental Affairs Committee, so that a committee looks at the report and includes it in their monthly agenda.
Okay. So are you going, can you add that language into the contract or?
Yeah, I'll add it to both the council and the committee, governmental.
All right, is there any other questions on legal services? He has some different ones on it, on his legal services. He's talked about working on the 105 leasing project. He's assisting with low-income housing tax credits, new market tax credits. There's different things that he's actually put on there too, and he's also helping with the Class 3 gaming compact with the state. So he's kind of taking the lead on that. So he's doing quite a bit for us, but we just need the reports that's reflecting that what he's doing. So, any more questions on this, Pam?
Yeah, on the assistance with low-income housing tax credit, new market tax credit, that one there, is that like something assisting housing, or is that something that we're talking about doing for the new homes that we're building?
Right now, the assistance with low-income housing tax credits only allowed by the states. The states get that for their housing, and they give us a little bit of it, but we're asking for our own, and we'll be able to use this low-income housing tax credit so that we can. It's basically a donation that somebody can write off by donating money to the tribe or for building houses. So that's what we're asking to do right now. So that's what he's working on.
Okay.
I explained that right? Lord?
I have a question, and I don't know if it pertains to these lawyers, but what lawyers were involved with our lawsuit with IHS? I'm asking that just because I feel like the tribe didn't ask for nothing specifically from IHS, so our hospital has been staying the same, and I guess I was gonna bring it up while IHS was here, but I just don't know.
This is Lisa. I can answer that for you. So the attorneys that filed the actual lawsuit was Robbins and Kaplan, and it was Brendan Johnson and Bruce Finzen that did the actual attorney work. And it wasn't nothing in the lawsuit that we specifically asked for anything from IHS. What the issue in the lawsuit is to that they were violating our treaty rights. And so we could use that to move forward into asking for more money from Congress. But right now we're working on getting a public health forum together where Brendan Johnson and Bruce Finzen can come down and facilitate that. And that there's already been a motion made to have River Bluffs out of OJ Siemens' team start to do that. And we're looking at the first part of May to get that together, so we can take our testimony from tribal members, and we can start to use that to start filing for stuff. So that's kind of where we're at with that.
Thank you.
Okay, is there any more questions on the resolution? If not, I'll call for the question. Ray? All in favor?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Online, Tennille?
Yes.
Lisa?
Yes, what was that resolution number?
81? Eileen?
Yes.
Donna?
Yes.
14,
Opposed?
0,
Not voting?
0.
Motion carried. Okay, are we gonna bring the other one up for Dell later on today, or before we leave, or are we gonna wait for that one to go back to budget and finance?
No, I guess we can bring it back on. The only wording that needed to be changed in it was review in a lot of the paragraphs. So if we can go ahead and bring it on, and then I'll just take out the reviews. That's all I wanted Wayne to do, but
Had a number on it already. The number was 66, so if you wanna reconsider and approve, resolution 2023-66.
Needs to be approved.
This needs to be approved? Oh, it just needs to be approved, motion to approve.
Oh, okay.
That's not yesterday.
It was presented as emergency, but it passed. It has a number.
so do we do it as emergency? No, just motion to
You
approve?
wanna read it again, so we know what it says and we can make the amendments?
Okay.
I need that back because that's the secretary's copy, so.
I know I gave him my copy too. Motion to approve resolution 2366.
Need a second? Jordan? Go ahead.
I'll start with that fourth whereas. Whereas the Rosebud Sioux Tribal Council requires legal and lobbying services on the following matters. Realty issues, including fee to trust and guidance with pending and future applications with the BIA process. Take out that, or how are we gonna say that for the review of fee to trust regulations? I'll just leave that. Indian land consolidation. Take out issues, facilitating access to energy resources, boarding school records, and U.S. Department of Interior policies. I took out that review of. Whereas the Rosebud Sioux Tribe has reviewed and approves the agreement of the legal services proposed agreement with Arrow Creek Law and Mediation, PLLP, Donald Dow Lavender of the Rosebud Sioux Tribe on the date set forth in the terms of the agreement and upon execution. Therefore be it resolved that the Rosebud Sioux Tribal Council authorizes and approves the agreement with Arrow Creek Law and Mediation, PLLP, Donald Dow Lavender, and the Rosebud Sioux Tribe on the date set forth in the terms of the agreement or upon execution to be billed at an hourly rate of $290 and expenses for a total amount billed not to exceed $50,000 within the written consent of the client. I think all that was supposed to change to, there's amendment in there, that was supposed to be changed to like how Van Norman's is, where it's supposed to be $6,000 per month.
Okay.
So I'll take out that at the hourly rate. And this is for 1 year, right? So. Whereas the term of this agreement shall commence on 2/15/23 and will continue unless otherwise terminated upon conclusion of the provision of legal services and engagement is concluded, and be it further resolved that the president of the Rosebud Sioux Tribe is authorized and directed to sign and execute the agreement for legal services and any other supporting documents.
And can we put the same language as far as reporting?
Yeah,
Yeah,
we'll
thank you.
include the monthly reporting, 1 to, what was it, 1 to or governmental affairs and council, right?
I thought it was monthly/quarterly.
Monthly was if they could, and then if they couldn't, then we were giving them the option of quarterly, right? So I guess, yeah, we could go ahead and put monthly/quarterly. Whichever one works for these guys.
Okay, is there any questions or discussion? The number is, what is that number? Is what, 66?
Yep, 66.
No, there's no discussion or questions. I'll call for the question. Vanessa, all in favor?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Online, Tennille?
Yes.
Donna?
Yes.
Lisa?
Yes.
Eileen?
Yes.
14,
Opposed?
0,
Not voting.
0.
Motion carried. Okay, we're just moving right along here, guys. We're gonna be done before noon, hopefully, maybe. We have a few more resolutions on there, but we decided when we got through the resolution, we'd go back to the top. I invited IHS down here to give, for Dale to give a report. I told the health board last meeting that, when she came aboard, she's acting right now, that we did go up and address some of the, issues that were going around by email, concerning the emergency room, the incident in Parkston, and other issues that we had talked about. So, just so you know that they were discussed already. So, are you ready for IHS to give her a report? Okay, Dale. Yeah. Okay.
You go up front? Sure. I'll go wherever you like. Microphone and camera right on you. Perfect.
Chairman,
Yes, Donna.
can you have the roads checked because we got Head Start out on the road and it's a concern for some of us. Thank you.
Okay.
That way for the folks on the.
No, just right
Or
there.
just
You're
straight
fine.
ahead?
You're fine where you're at. They'll do
Okay.
a side shot of you too.
Perfect. All right, can you all hear me okay? All right, so my name is Dale Knudsen. I am from Long Valley, South Dakota. My mother is a Livermont, and then I'm an enrolled member of the Oglala Lakota Sioux tribe. I've been a nurse with Indian Health Service since 1994, started here in Rosebud on the inpatient unit. I was asked to come down here and be acting CEO, and I've been here since January 17th, have been doing a lot of learning. I will say that, as usual, the Rosebud staff has been very kind and gracious to me, as well as the tribal partners. Skyla and I chat about every day on the phone, and some of the health board has also reached out to me via phone. I'm always available. We have dealt with some concerns that were brought to us initially right away. We've made some changes with staffing in the ED since I've been here. That has resulted in no formal complaints that have come through our grievance process since we've made those changes. We have had a big flooring project that got initiated in the ED February 28th. And so Callie posts a lot of information on social media about where we're at in the phase of that. We anticipate that to be completed by the end of March, and so far it's been going very well. And we appreciate the public's assistance with us as we encourage everyone to, sometimes we have to change the flow for where people present, but the first part that got done was the waiting room. And so that portion is complete. So as people access the ED, that portion's done, and that process has not changed. We've had a lot of projects going on, physical projects going on to the plant. Ed Arquin, our facilities maintenance guy, takes the lead on that, and we've had a lot of good things going on. We anticipate the parking lot starting this spring. So we're very excited about that. Had some calls with the contractor on that. Seems to be moving forward. Our inpatient unit has been tracking right along. We've had regular inpatient stays. Our ED remains at about the same acuity level that it has been. Very busy, especially over the weekend. It was very busy. The challenges I would say that we've had, there were some, lot of questions I got initially one-on-one with some community members regarding PRC or denials. I have dealt with every one of those that has come to our attention, and our committee meets every morning to ensure that that process maintains. We also have a process by which, if there is an appeal, we circle back and review those cases again. And sometimes, depending on the situation, those appeals are overturned, the denials are overturned, and those go through. I have had some complaints on dental that have been addressed, and we continue to work through those processes. We also have had a lot of new staff join the facility. We continue to work with our human resources processes. I do have some numbers I can share with you. If I can see, hang on, I got to get my bifocals right in the right place for this. So right now, as of February numbers, we do have an overall vacancy rate of 41% for the entire facility for all the departments combined. We have made a lot of offers recently, especially to pharmacy, because we're at 47% in a vacancy rate there. Unfortunately, the 2 people that we had onboarded and selected have declined, but we have a 3rd one in the works. We do have a physician that's going to be starting on Monday. So we're excited for him to begin. And we also are anticipating a nurse practitioner, a psychiatric nurse practitioner, that will be onboarding very soon, likely within the next 30 days. And then we've had a lot of local folks start in some of our business office. Trying to think, when we had Neil, we had a dental tech that started, and we had some folks that began in HIM too, in the medical records department. So we always are very anxious and happy to get those positions filled and hope that this results in long-term employment with us. One of the challenges that we have had, which I did discuss with the health board last week, is our transfers. We have had quite a few air transports because ground ED or ground EMS transport hasn't been available. So we're trying to learn why that's an issue for us here. I've come to understand through my discussions with Skyla that there are some staffing issues at that department, and we just need to work together to try to resolve some of those issues. Because the air transports do incur us a lot more financial responsibility than a ground transport. So we look forward to any conversations and communications we can have with you all around that. Any other questions for me?
Any questions? I haven't had a report for a while, so thank you for coming down.
You're welcome.
Great.
Yeah, thank you for coming. I guess one thing I didn't hear you mention was the need for nurses. I took, where I looked it down there on Monday, there was one nurse, and she was going between 4 rooms, trying to attend to everybody. So, I'm assuming there's a...
Was that in the ED or upstairs in the clinic? Okay.
And I was there, and we were there for about an hour and a half for a simple thing. But she was, so I mean, you list all your issues, but you didn't mention the shortage of nurses that you guys have.
We have a shortage of nurses, not just here.
So is there a plan for that then? I mean, you guys have a plan in recruiting and...
Yeah,
like you mentioned,
we have open...
You mentioned all that stuff, but the main thing was nurses.
Yeah. No, I appreciate that because my background is a nurse.
Very frustrating to do
Yeah.
for a few hours for a simple thing.
Absolutely. I hear you and I understand that. We have a huge nursing shortage across the nation right now. The paradigm of nursing has been really changed from a dynamic of having permanent full-time staff to having a lot of contractors. That's not just happening with Indian Health Service, that's happening across the board. Travel nursing has been something that during COVID became unbelievable. And nurses have really changed in what they're looking for related to that. That has not just impacted Rosebud, it's impacted every one of our IHS facilities. I will tell you from my regular role that what we see is, we used to see a lot of contractors in mostly OB and ED. And now we're using contractors in outpatient, we're using contractors in inpatient, and we never used to have to do that before as an agency. We always had full-time permanent staff. So it's a challenge. We continue with our recruitment efforts. Having housing available is critical to that, but we do have housing available. We just aren't, quite frankly, seeing applicants, and it's not just here. It's very much everywhere, and this is on a lot of national forums up for discussion because everybody's concerned what healthcare is going to look like in the next 5 years, the next 10 years. We don't see a lot of graduates coming out of nursing programs. So that's another thing that we have to address. And one of the things that we're talking about locally is maybe we need to talk about how unlicensed assistive personnel can help support some of those efforts, certainly in outpatient, where you have nursing oversight, but you have a lot more hands that can do some of the pieces of that visit. Certainly not all of it, but some of the pieces. But I do thank you for bringing that up. That is a huge concern for us, not only for nursing, but also our providers.
I remember you guys were going to work with SGU to help with their nursing program. And I don't know if that's not happening, because I know a lot of them that are driving to Valentine or Winter to do their technicals or whatever it is. But.
Yeah.
So that is a plan that we're working on. So I'm working on the collaborative agreements right now.
When will that be done? Because I feel like this got brought up this past fall as well. And, I mean, we're still not.
Mm-hmm. It's a process we have to go through to get those approved. So it's at area level right now, and we were actually just addressing it yesterday. So hopefully it'll be soon, but it's just not SGU. We're reaching out to other tribal programs also. OLC, I just had a conference call with a lady from New York University out of New York City last night. She had done her clinicals here probably like 10 years ago, and she really liked the community, the culture, so she wants to work with her program, incorporate here to bring people back for clinicals again. So we discussed that, and it's just not nursing, those are providers to nurse practitioners, so we're making the efforts to do that, and then I'm also wanting to do USD and SBS. So it's in the works, so.
Is there a time frame on that, like an approval process?
I would be.
Considering that was, I used to do that, now they don't anymore?
We do it right now. We have worked with one school, and they're pretty proactive. The University of Wisconsin. Those nursing students come out. They'll actually be here next week. And there's 13 of them coming this time. So half will work at the hospital. The other half will work like with Tree of Life and some other programs in the community, and then they switch. So we're kind of using that model to move forward with the other programs and then collaborate between their staff and others.
And we can make that a standing update for you all so that you know which collaborative agreements we have in place with different universities and a schedule of when, if they're interested in coming to us, yeah, because we know that's a huge recruitment opportunity for us.
And it is. So the University of Wisconsin, on our call that we had recently, some of the students that came out did their clinicals here, and one of the nursing students had just passed her boards and was going to work at a private sector for like a year, and then she wants to come back to Rosebud. So she has my cell number, so yeah.
I remember those nurses yesterday. My boy Jeff was 8
Yeah, we have Pam and Fremont, Vanessa, and
Good morning and welcome.
Thank you.
One of the concerns that a lot of people are having is with our air transport. I don't know, a few years ago when Mr. Long was still with us, there was an agreement that was made with, I believe it was Air Med, was it? Or one of them, they were supposed to be posted up here and stay up here, whatever, but are they still here and are we still utilizing them to do our transporting or flyouts?
We have multiple flight teams that we use, but we have Eagle Air, which is also known as Guardian Air. They're on the runway or the hangar behind us.
Yeah.
They recently had a fatality in Nebraska, so they shut down their services for now, but it has not hindered being able to obtain transports out. So we use Mark Air. There's Apollo out of Pine Ridge now. We use Care Flight out of here, and then we have Sanford, which they have a NICU team also, and then we utilize Black Hills Life Flight. We've even had to use the flight team out of Scottsbluff before, so it just depends on the weather. Like yesterday we had to send a girl by ground ambulance down to Winter. Valentine. They could land there, and then we flew her out from there.
Okay, the reason why I bring it up is because we had an agreement with this air flight team. And there was a guarantee that our patients who would get flown out would not see a bill. And it was because they were gonna work with IHS itself on the costs.
Okay.
So I don't know if using these other air teams, if they're causing flight issues for some of our members. But that was the whole reasoning behind having that agreement with them. And I don't know if we need to bring those back to transportation and have you guys bring back your list of who all you guys are utilizing and develop some kind of MOU, MOA with them, because that was one of our biggest concern. We had so many tribal members. We had a public hearing here back in 2012, I think it was, and that was one of their biggest concern, was because they were getting charged for these flights. And then we also have people who should be getting charged their flights through not only IHS but through Medicaid also. Now, in that contract, there was that they would never exceed after they pulled from IHS and after they pulled from Medicaid. There wasn't supposed to be any cost to the patient.
So no.
That must be happening because there's concern with it. So maybe for our next transportation meeting we have next Tuesday, maybe by then, if you guys can get some of that information together for us and bring it to transportation so we can look at what the original MOA was versus all these ones that you guys are utilizing to fly out.
So I will say that for hospital designation for CMS requirements, an emergency room has to comply with EMTALA law. And that means that wherever the quickest, whoever's available, when we put the call out that we need an air team and we know we have an accepting hospital or physician, whoever can get to us first to transfer that patient. I thank you for bringing up this contract because I'm not aware of it. So I will do some learning about that and try to get some better understanding and detailed information.
Yeah, because this flight team was supposed to actually be based here.
Okay.
I don't know where did they ever move the flight attendants to? Do you know, Chairman?
I don't.
You don't?
No.
Did it change? Because it used to, if it was Air Med, that, I'm not familiar with that one since I've been here, but I'm wondering if it changed to like Eagle Air or Guardian, the one that's behind us right now.
I think it's always been Eagle Air, Guardian.
Okay.
I heard Med Air or whatever before too, but it's always been Eagle Air.
And they were supposed to, I don't know, I guess since Bob hasn't been here, we haven't really heard anything in transportation regarding it, as far as where they were housed at, because if you remember, they were willing to buy their own double wide trailer and put it out to the airport so that way their flight teams would actually like live in there. And then I heard they had an apartment or something at the compound, so I don't know. It's been a while since we've heard anything also on it.
Okay.
I don't know, maybe that MOA, MOU is void now. I don't know, but But it was something that the tribe had with this air?
Yep, because of the cost of the flights, and IHS at the time did agree to it.
Okay,
And they were allowing it to make them be the first people that airlifted our people out. And then that way the cost or whatever wasn't to the patient. It was always either IHS and Medicaid picked it up or just IHS, but they went with whatever guidelines you guys carry for fly out.
yeah, there is a rate, like a Medicaid, Medicare rate, and then probably an IHS rate, but I will definitely look into that history and try to provide some information on that.
Yeah, because I think that's kind of being the concern right now. I think a lot of our patients are once again getting them bills again on getting a fly out.
Okay,
And then also, Chairman, at some point, I think we need to visit with, or maybe you need to visit with our ambulance department and see with the ground transport part of it, because I do know that they were saying that there was some that could have actually been driven to Rapid City or Sioux Falls, wherever, but there was no driver or something. So maybe you can get with Eric and see where that's at.
I will do that.
Thank you.
We have Fremont and Vanessa.
Okay, thank you. Do you still have that MOA with the VA?
yes,
Recently, my nephew, he's a veteran, and I believe he went to Winter Clinic, and he opted to have his prescriptions here at the IHS pharmacy.
mm-hmm.
So he was under the assumption that everything was all ready, and he came to pick up his meds, and nobody bothered to do anything with it. And then he needed those prescriptions, those pills right away, because, he's got one of them, what do you call it, behavioral health issues. So, but anyway, they said they couldn't do anything, so he went to the mental health office over there, I guess, and he talked to that person, and I'll see what I could do. And then about half an hour later, she called him back, and he had the prescriptions already, so.
Okay.
What they did was they were just sitting there doing nothing,
Sometimes we have to have better collaboration. If he went to Winter, we may have not gotten or received that. It might have taken a phone call. I'm very happy, though, that he was able to reach out to someone and they were able to correct that. But often when we are trying to receive information from another facility, they're usually doing that by a phone call or a fax number, potentially. I'm not sure what the details were in this case, but we definitely.
I think he brought the prescription back with him and he gave it to IHS, so.
If that was the case, it should have just been filled.
It's ready, sitting on it,
Okay,
I've had similar problems like that about 5-6 years ago when I was getting prescriptions from VA so I opted to do it here and I never did get it.
okay. It shouldn't be an issue because we accept those prescriptions.
And then my last issue is I had a grandson here who passed on here about 2 years ago. IHS flew him to Sanford Hospital in Sioux Falls. And he passed on, and now they're sending bills to him. And do I give it to you people?
Yes. Please bring it and we'll definitely look into it and see if we can get things resolved. And if I'm not there, you can give them to Dave or Lisa Bordeaux is our liaison and she can accept those as well.
Vanessa.
Good morning, colleagues and admin. Thank you for coming.
Thank you for having me.
Maybe I'd like you to explain to the public about when they go in to see IHS and they get referred out. but a letter comes back and they're denied.
Sure.
So what the procedures for them to go through in order to go back in and get a referral again?
Sure. So our clinicians, all of our providers put in referrals to outside entities on a regular basis. We have purchase and referred care committee, and all those referrals are reviewed by a physician on staff. There is a priority assignment given to those referrals. And the other thing is that Indian Health Service is a payer of last resort. So sometimes someone will be issued a denial letter because they have Medicare or Medicaid. And because Indian Health Service is the payer of last resort, that's an automatic reason why we would issue a denial letter. Every denial, though, is available to be appealed. And I receive letters daily. And sometimes it's just a visit. And for someone to want to discuss their concerns about that denial letter, and they will implement the appeal process, which they have the right to do. I believe the time frame is 45 days from receipt of the letter. And then we take it back to committee and review those with the medical provider. And sometimes those are overturned, and sometimes they're not. It does depend on our funding availability for the PRC. And that is why the air transports are a concern to us, because those are a much higher dollar. Those are generally covered under the PRC funds. And when we're extending a lot of that out, it does impact our ability to approve priority beyond priority 1 and 2 and down to 3 and 4. So that's why collaboration is very, very important.
We got a few more questions from council. Jordan?
Thank you for coming. Nice to meet you. I guess I had a follow-up question on my colleagues about that committee. So is that committee filled with other, like, providers? Are they doctors?
Yes.
Are they,
The clinical director, who is an MD, right now we have Dr. Charles Martin down. We borrowed him from Eagle Butte for the last few months. And he is part of the committee's decision-making process. I'm a member of that committee. We have case managers that participate in that. And then the PRC staff are there to bring up the referrals on the screen so that we can all see them. And then once the priority level is designated, then they do the issuing of all that information.
how many, do we have actual doctors there? Or are they all like, what are they, practical nurses?
Sometimes.
Do we have doctors?
Most of the time, it's the clinical director who is a medical doctor at this time.
Okay.
And the gentleman that's starting Monday is also a medical doctor, and that will be something that he assumes. If we have staff out on leave or whatnot, we do have some nurse practitioners that work in the clinic that issue referrals as providers and see patients every day, but they sometimes are a fill-in for that process.
I guess I just kind of wanted clarification on that because we receive emails a lot. And then some of them are saying that that committee is not filled up with doctors. And then so it's like kind of contradicting. Like if I'm not a doctor, right? So if somebody comes to me and say they need to be seen, but a doctor has that referral, then I don't feel like I should be making that decision saying, no, you can't go, when I have somebody who basically outranks me saying, yes, you need to go to a specialist.
So it's not a yes or no discussion, it's a priority discussion. So they look at the content of the referral, the medical condition involved, and they rank him. It's not a yes or no discussion, it's a priority ranking 1 through 4. 1 being the most life-threatening potentially to an individual, and 4 being something that is not life-threatening.
I guess I kind of disagree with that because we have, I mean, I get told, I have an email right here that's stating that To me, from what I read, is that it's pretty disheartening that this lady has to keep jumping through these hoops. And from what I read, she should be up there and be getting the services. But not only this lady, but others in the past, and we eventually lose them because of the services that we receive here. So I guess I'm just looking for clarification on how we make that better. Like, I understand PRC dollars and we may not have enough of them, but then help us solve that issue with getting our people the correct health care they need and more PRC dollars, so we don't have to sit here and struggle through it or have to risk losing them anytime they get sick just because they can't afford Medicare or other health insurance. And that is a story for most of our people, that they have to go to IHS. So I guess I'm just looking for answers about how to make it better. If there's something that we need to do here as a tribal council to pass legislation to make those dollars come down, tell us that or help guide us, because right now it's just feeling like we get the same complaints every time and nothing's being solved, and it always comes back to PRC dollars. We're not getting enough. But I mean, and I brought up when you guys walked in the door our lawsuit that we won. I mean, if that's something that we need to utilize, then we need to utilize it in the correct way to get those and get better health care for our people.
So thank you for that. I can tell you that as federal government employees, we're prohibited from lobbying Congress. But we certainly can work with tribes and tribal councils to understand the complexities that we have under the rules that are put in place by line item funding and such. So to help inform you and the public of the best moves forward. One of those, and I'll just use this as an example, is we have patient benefits coordinators. They do try to work with individuals that may qualify for third-party dollars. That is something that does help our system when someone does apply for Medicare or Medicaid, because as the payer of last resort, then those dollars are utilized first, which basically leaves that in our bucket to fund and maybe pay the copay if we can, if that makes sense. Finance is not my strong point, so I always feel like I probably should be the last person describing it as a nurse, but we do have challenges along those lines, and so we do try to have systems in place. If someone is turning 65, I would encourage them to make appointments with our patient benefits coordinators or just drop on in and ask to have that information given to you. We're also willing to go out to community events and set up booths and tables to inform the public and help assist people with those, because those application processes can be difficult and time consuming. But they do help the bottom line of the checkbook from that sense, because when we have individuals that have those sources, then our resources go a little farther.
Thank you.
Thank you.
Okay, we had Norman, and then Fremont had another comment.
Okay.
Go ahead, Norman.
That's one thing I hate for that. I just want to know about, when you go to ER, people are waiting for 3 or 5 hours just to get seen. Can we make that order for them? Over there, up there for them? Because I have to go to 4 hours to get this.
So
That's what's going on.
thank you for that. So 2 comments I'll make about that. One is that the ED is a busy place, and we never know really when it's going to be the busiest. When patients present to the emergency room, we do what's called emergency severity index, is a process that we utilize during the triage process to determine how critical that patient is. And so as I'm talking about this, I see in healthcare we like our ranking systems, but essentially that is a ranking system. If someone is in a car accident, they're very likely to be an ESI level 1, which means they're going right back into the exam room. And then other things might have a lower ranking, so they'll be placed in the waiting room until such time that we have enough
folks to get them through. Now, we staff that ER with 3 providers and 4 nurses, plus support assistant staff in there. And so we should have adequate staffing at all times to meet that need. The other thing I do want to say about that is with emergency room visits, it's very important. Primary care is probably the most important thing that anyone can do to have good long-term health outcomes. And that primary care is in the outpatient setting, seeing the providers or the team of providers that our patients work with on a daily basis to manage whatever condition they have, whether it's an acute condition like an earache, or if it's something like a long-term chronic disease like diabetes that you need to get seen on a regular basis, have medication adjustments made to help bring those blood sugar levels down. And it's very important that folks try to access their primary health providers or the team of providers. We do have teams of providers up there to make sure that that continuity of care for those conditions occur. And the ER utilized as the last resort for really urgent and compelling issues or acute issues, because sometimes those happen in the middle of the night and the clinic isn't open. But we do watch our wait times. We watch our wait times from the time someone checks in to the time they're triaged to the time they get a medical screening exam from a provider, as well as their entire throughput through the ER. And it does fluctuate based on time of day. We tend to be busiest from about 6 in the morning until midnight, and it slows down sometimes after midnight, not always, but generally that's what we see. So there will be times of day that are that may require someone longer. Thank you.
Fremont. Oh, okay, all right. Go ahead, Keith.
I got a question. Good morning.
Morning.
Council. A few things that you elaborate on was, I know a lot of council here is medication. And a lot of times, either it's email or fax. And I know the pharmacy is busy or not busy, but when that's sent in several times, they're not reactive. The patient waits. And sometimes there's medication for the individuals that you don't have. So there's an alternative that they have to go to Cherry County in Valentine, Nebraska to receive that medication. So those are very important issues to really concur with it, because I know you don't have those types of medication on hand in the pharmacy. But I know there's email and fax, but they have to wait a period of time. When they get there, they expect their medication to be ready, and it's not ready. And they say, you gotta wait because I gotta, no one faxes, no one email, but it's there. Or sometimes they hand deliver it to the pharmacy. That usually waits. So there's a lot of complaints on that, because when I go up there, I see a lot of elders tell me that they don't have this. Where do I go? It's always time to go to Cherry County pharmacy to get your medication. That's just where it's at now.
So thank you for that. I would like, if there are individual cases like that we could delve into to see if it's a communication issue between the electronics. I know we have a staffing issue that we are trying to get rectified as quick as possible. We do have a new pharmacy director who has been, in my perception, amazing since she got here. And she's really turned a lot of processes around in the pharmacy, just in the little bit of time that I've been here, that have resulted in less customer complaints, at least in the time that I've been here. I would also say that, just for awareness, there is a process. IHS across the agency has a formulary. And that's, excuse my nursing terms, if pharmacists that are listening may not appreciate this, but from my understanding, that IHS formulary is a long list of the medications that we keep in stock. However, there are processes for us to receive medications that are non-formulary. There are things that have to be completed for that, but there are patients that do receive medications non-formulary, and I can get you all some information on what those processes are, and we can put information out to the public. Sometimes that's very dependent on the medication and the individual's needs for those meds and the types of meds. There are likely some that we might not be able to get, but we do have a process for that, and I would be happy to make sure everybody knows what that process is.
And I got one more.
Sure.
Inpatient service.
Mm-hmm.
When a patient goes there, like they have a 9 a.m. schedule, I know they're running late at times, so they only get seen by 10:30 or 9:30 or 10 o'clock in the morning. Okay. They get seen, they sit there. In the process is their medication, and they don't leave the hospital until about 4:30 or 5 that evening. Why is it?
So are you speaking to discharges? I just want to make sure I understand. You're talking about someone who's inpatient?
The process of them, the patient seeing the doctor, getting done, waiting for the medications at pharmacy, waiting for it all day, now that evening until it's crossed.
Outpatient.
Outpatient?
Yes.
Okay. We can definitely look into that. I feel like that's kind of a pat answer, and I apologize for that. I don't know that we look at the throughput times from a time a patient comes, gets seen by the provider, and outpatient to the time that the medications are filled. But that certainly should be something that we can look at, and we can get some data on that and see if there's probably most likely opportunities for improvement. But that's not a report I've seen unless, Callie, you know? Okay.
I just wanted to respond with that, just keeping communication with each other. So like, we identified keeping communication like with ACF. So when they would pick up meds, it just wasn't working, like some of their meds wouldn't be ready. So we just communicated by phone and we set up a process. And so we tried it, we adjusted a little bit, and so now I think it's fluent and it's going well. The thing that I would recommend with, like, if prescriptions are getting faxed in, and the person saying, or the pharmacy's telling that person we didn't get that fax, we should know about that because we should reach out to that facility and make sure they have the right fax number.
Right.
So sometimes there's multiple faxes throughout the hospital, and for whatever reason, that company will get the wrong fax number. So then accountability and such, and we can work on those processes, but to take that fax forms. So sometimes I think that's where it's lost too. But if you let us know, or that person, you know, is frustrated, they just need to come down to admin and we'll help them. Yeah, I'm willing, I mean, we're all willing.
We're all willing
that,
to,
so, because we know it needs to be improved, but just need to know.
All right, Chase, good report.
Vanessa.
Sure.
I have one question. So like some of our people go to ER and do they still call the people at home to let them know that they're there? And because there was an incident where an individual left ER, they were released and their ride didn't get there in time due to the roads. Then a person left walking in the storm.
Oh, dear. Okay.
So that was just my concern, if they could be kept there until the individual gets there so people don't have to worry out looking for them like in this type of weather.
Well, certainly we would encourage if someone's waiting for a ride to stay inside the hospital, especially if the weather's bad. We have the waiting room available. Wouldn't want anyone to be out in some of our severe weather because we've been really cold this year. Typically, we don't call individual family members unless the person that's being treated is not able to consent to any decision because of maybe they're unconscious or something. And then we would be only able to contact who they've listed as their emergency next of kin in the record. And Callie, you might want to speak to this a little more, but we certainly are available if people are having trouble getting hold of someone for a ride or things like that. Our staff can help make phone calls if they're not able to reach someone and work on processes for that.
Yeah, our typical process is for people not to leave the ER until we know they have a safe disposition or a ride. So I know we do work with CHR, and they go, I believe, till 11:30 at night. Sometimes they'll go a little later if we need to, but we have cell phone numbers for them. And then usually staff will call if we can't find somebody a ride, and then if they say they've already contacted CHR, can you help us find a ride for this person? I'll usually text Skyla, and then we can work something out where she'll send like a COVID pass person over to give them a ride home. Just need to know where they're going and if they have any like respiratory thing that would be contagious. But that's normally the process that we follow. So, all right.
Thank you.
Okay, anything else? Dale, do you have anything else?
I don't have anything else except to thank you for allowing me to be here, and I'll be here as long as you need me.
Okay.
Chairman,
Yeah, go ahead, Donna.
I have a question. And
Go ahead.
mine is regarding the Ascended School. Did a survey because of the career tech school that's going to start in the fall. Nursing was part of nursing and nursing aid. You have a representative school.
You're breaking up, Donna. We don't know what you're saying. Sorry.
Sorry, we're looking for a representative because St. Francis Independent School is going to have a CTE, Career Tech School in the fall.
Okay.
And on the survey was nurse aid from some of the students. So we're looking for a representative to work with the school for the nursing aid program.
I think that's fantastic, Donna, and either myself or Callie, we can get a whole team of representatives for you. One of the things we like to do is invite the high school students up. We have a career fair every year. I have a nurse recruiter at the area office, and she comes down for that as well. We also have summer student extern positions that are paid positions. So any type of collaboration we can do on that for certified nurses aides or any other type of healthcare thing, we would be very happy to participate in those, and we welcome that. You just reach out to Callie or myself, and my cell phone number is 605-380-9263. And my name is Dale, like a guy.
Thank you.
Thank you.
Okay, Dale, thanks for coming. We appreciate it. I think council, we're gonna probably let out early here. I think White River is letting out at noon, so if we can finish up.
This is Lisa.
Yeah, we'll
I'll make a motion to approve Dale's report.
Okay, motion on the floor, second by Pam, question by Jordan. All in favor, if you would go around and shake hands, please.
2, 3, 4, 5, 6, 7, 8, 9, 10, 11.
Online, Neil?
Yes.
Lisa?
Yes.
Donna?
Down, Dale.
13.
Opposed?
0.
Not voting.
1.
Motion carried.
1301.
So we can check this. gotta take to, didn't
No,
you know they're doing that?
Thank you so much.
Nice to meet
Thanks for coming. I
Thanks.
appreciate it.
Thanks for having us.
Okay. Is that 5-6? 5-6-3-9?
Yeah, 5-6.
Okay, all right then. See you.
Thanks for coming.
Thank you.
Chairman, personnel has 2 resolutions as well.
Okay, can we do those and then we'll just recess or adjourn and we'll, I'm gonna let work out early today, so we'll do that.
I have so much on my mind.
Yeah, I
it's
know.
blowing by. Thank you.
Hey, Scott, have you gotten any feedback or response from the court administrator regarding Aisha Concha's contract and past invoices that we owe her?
No, I haven't talked to her about it or anything, but it needs to be done. It needs to be brought back up.
All right.
You, maybe have Eric here, please call and make sure everything's ready to go on that?
Okay.
Can you shut down that one or?
Yeah, I was gonna, Writer was getting off at noon, so if I shut off that one, then people are gonna take their lunch break anyway at 12 and they're gonna be done, so. I'm gonna let out at 1.
I guess I'm just kind of concerned with people who are waiting for flyout checks and stuff. Those are gonna be done and people are gonna have time to get here to pick up.
Yeah.
That's always my only concern is people get told to wait till today on certain things and then when we shut down, they don't.
No, we can't help the weather though, Pam.
Yeah, I know.
Yeah.
Okay. We got, a resolution 51 and 52, health board or personnel. Are you gonna bring it on, Eileen?
Yeah.
Motion to bring on, a motion to approve 2023-51. Second by Ray. Go ahead and read it into the record. We'll have discussion.
I'll start at the fourth whereas. The RST Personnel Committee recommends the RST Personnel Policies and Procedures Manual to be amended to add provisions to amend Section 2, Employment Conditions and Provisions, Section 8, Hiring Practices, Subsection 8, in-house promotions and transfers by inserting language as fully set out in Exhibit 1, RST Personnel Ordinance 2020-10 attached, and therefore be it resolved that the Rosebud Sioux Tribal Council adopts and amends to the RST Personnel Policies and Procedures Ordinance recommended by the Rosebud Sioux Tribe Personnel Committee. Be also resolved that the effective date of the amendments to the Rosebud Sioux Tribe Personnel Policies and Procedures Ordinance shall be upon the final approval by the Rosebud Sioux Tribal Council. So there's some holidays. Oh, I went and read 51. I was gonna do holidays first. But I decided, I mean, it was 52, so I have to do 51. So, this one is, I shall read Exhibit 1, ordinance number 2020. And
It wouldn't be an ordinance.
No.
Rosebud
50%
Tribal
ordinance.
Policies and Procedures Manual, Article 2, Employment Conditions and Provisions, Section 8, Hiring Practices. Section 8, In-house Promotions and Transfers. Added language shall be underlined and deleted text shall be indicated by striking through as follows. In-house promotions and transfers. Promotions within the same department and an employee who is promoted to a position with a higher rate of pay will be on a 30-day performance evaluation, not probation, if it is in the same department. At the end of the 30-day evaluation, the director, in concurrence with the human resource director, has the authority to put the employee on a probation period for 30, 60, or 90 days. If at the end of the initial or extended probation period, if the employee is not meeting performance requirements for his or her new position, a demotion may be warranted up to and or including termination. 9, I gotta read this. Interdepartmental transfers. Interdepartmental transfers must be approved by both departments and affected employee, the human resource director, and the tribal president. Any transfers to other departments will be on probation for 60 days. If employees are not performing, they can be extended on probation for another 30 days and could be terminated if not, still not performing.
Okay, Pam, question, comment?
I have a question. So, letter A talks specifically about being in the same department. Under B, does it talk about if you're going to a different department?
Go ahead.
I just kind of, so the way the current policy reads is if I'm transferring from Department A to Department B, there's no probation, just a performance evaluation. But if I'm transferring from within Department A, I'm on a probation, so they're kind of backwards. So we're trying to correct that, where you're on a performance evaluation when you're doing an interdepartmental transfer, as opposed to transferring to another whole different department. So right now they're kind of backwards.
Okay, and then, so if I'm going from finance to business office, just getting a pay increase, I'm getting a evaluation done, but the director can keep me on that evaluation up to 90 days? Is that what it
So,
means?
and you will be on probation, yeah, because you're going from, let's say, finance to the business office. So you're on a probation because you're going under a new director. But if you're in finance, you're going from one position to another, it'll only be a performance evaluation.
Okay, and then you guys, I guess that director still has the authority to evaluate me up to another 90 days if they don't like my first 30 days.
Yep. But like I said, right now it reads, if I was to transfer from finance to like the business office, I would just be on a performance evaluation. But if I'm in finance to another department or position, then I'm on a probation.
The other way around?
Yeah, because you're under a new department, new funding source, new director.
Okay. And then, well, I guess that's why I'm questioning, because 8 is in-house promotion and transfers, and then 9 is I almost said intertribal.
sorry. Interdepartment transfers.
So if you notice on number 8,
So what's the difference between an in-house and an interdepartment when?
like I'm saying,
We're all
in-house
the-
is within its own department, so let's say finance.
Okay,
Okay, and then if you notice, it's a 30-day performance evaluation. It says not probation.
yeah.
Interdepartmental is from a different department to a new one, and that's when you're on probation.
Then I get that interdepartment, right?
Because right now they're,
I mean, it just sounds funny that in-house is, I mean, it's all tribal programs. So it's all within the tribe, so that's why I'm
they all have
just,
different budgets, different directors,
Yeah,
yeah.
just not
Because
like
what
that.
was happening was, there was departments that were doing in-house, promotions and transfers into new positions, and they were put on probation, couldn't use their leave for 90 days. But yet, if an employee transferred to another department, they could use their leave. It was just, the way it read, they were just on a performance evaluation.
Okay.
So now it's just correcting it and switching it.
And in the personnel policies and procedures manual, it identifies what in-house is as having it within that department, in the same department. That's why it sounds like in-house within our programs, but it really isn't. It's within that program. But that's in mind.
So I'm curious if the definition should have been changed too inside the manual in the index or wherever it's at in there. Maybe that should have been changed too, because I guess that's where I'm saying I'm in confusion of it, but again, I know what you guys are saying, but I'm just saying the way the title of 8 is and the title of 9 is, it just kind of sounds like it's vice versa, I don't know.
Kind of pretty much spells it out on this interdepartmental. Departmental will tell you that it's different programs.
Okay, is there any more discussion? If not, I'll call for the question. Steve? All in favor?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12.
Online, Lisa?
Lisa, yes?
Neil?
Yes.
Donna?
Yes.
15,
Opposed?
0,
Not voting.
1.
Motion carried. Number 52, motion to approve. Second by Ray. Whenever you're ready.
Whereas the RST Personnel Committee recommends the RST Personnel Policies and Procedures Manual be amended to add provisions to amend Section 5 Employee Benefits subsection A Holidays by adding certain dates and modifying certain dates as fully set out in Exhibit 1. RST Personnel Ordinance 2020-10 attached, and therefore be it resolved that the Rosebud Sioux Tribal Council adopts the amendments to the RST Personnel Policy Procedures Ordinance recommended by the Rosebud Sioux Tribe Personnel Committee. Be it also resolved that the effective date of the amendments to the Rosebud Sioux Tribe Personnel Policies and Procedure Ordinance shall be upon the final approval by the Rosebud Sioux Tribal Council. There's 2 pages attached, and these are holidays that we asked that be added in. So the first one is the Blue Water Massacre, September 3rd.
Okay, so the ones that are underlined?
Yes, okay, underlined. Native American Heritage Day, Friday after Thanksgiving. Mankato Massacre, December 26th. Wounded Knee Massacre, December 29th. These will be holidays of the Rosebud Sioux Tribe will recognize.
Any questions?
Can we get the Mankato, can we put Mankato? That's what my version of it. I'll put the new one, no?
Parentheses are just
Just change Mankato and put Makato.
Makato.
Bluebird, yeah. kind of like in our history, Chocatoela, that's where he's from, so.
Okay.
I see Chobu, we should honor him.
Any more comments?
Well, I'm wondering if we should, add that as, slash, because, the tribal employees will know what it is, they might not know what that is, or we'll have both of them on there, so.
Put both of them on there? They know.
Or the,
Go ahead, Donna.
add it to the, holiday also too.
What holiday?
Which one?
Which one? We didn't get that.
September 3rd, put that one in Lakota also.
September 3rd.
Oh, the blue water one? Yeah.
Let's add that slash and.
Yeah.
Can somebody spell all that for
No CH.
Okay, let's call for the question. Vanessa, all in favor?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13.
Online, Lisa?
Yes.
Tennille?
Yes.
Donna?
Yes.
16.
Opposed?
0.
Not voting?
0.
Motion carried.
And
Personnel?
we'll have, personnel send these, new dates out to the employees so they'll know. Right,
All right, are we done with the resolutions?
I have one more, but I'll do that. Can I move it on to the next council meeting? That's
Yeah,
our
we
governmental
can do
affairs.
that on the 22nd. We'll
Yeah,
bring that
that's kind of
on.
a lengthy
So,
discussion.
okay, are we done with the agenda?
Oh,
Right, Pam?
I know, under resolutions, and I don't know if it's been done, I don't see our in-house attorney, but, if you guys remember, we had a special, what was she, the public defender or prosecutor?
Aisha,
Yeah,
you want to go see if Eric can bring that contract in and we can reconsider it again?
yeah, because remember, Judge Marshall sent out an email, a memo on that, so if there's no changes or whatever, we should get that passed for her to be able to get compensated. Also, Chairman, have you got to follow up on property and supply on the inventory of the ARPA and
I
CARES?
had a brief discussion with Loretta, and she was doing that. She was going around, she was getting the inventory, she was getting the condition of the vehicle, she was trying to get some type of log of maintenance set up for them. So she was on it, I never talked to her after that, so I'll follow up on it again.
Okay. And then also, can you remind, Mr., geez, I just totally lost his name, our Game Fish and Parks Director.
Oh, Matt?
Yeah, can you remind him also on them guiding services concerns and if there's any changes that he needs to, or that would like to make changes to his, requirements for any of his things that he go through the proper channel of land and natural and then on to governmental affairs to bring them changes forward, because I know there was some questions on the guiding services yesterday that he said he wanted to make some changes, but that needed to be done.
Okay, we'll do that.
Thank you.
We have Eric in here, was asking about Aisha. She's a special public defender right now. She had a contract that was presented here. There were some questions on it, but we want to bring that back. Do you have a copy of that?
No, I don't, that was, the court administrator who brought those up to the issue.
Okay.
I didn't get copies. I was working on getting her paid as special counsel. I haven't been able to make in contact with her. And I was directed to negotiate her, her agreement, but I was just gonna try to find a way to get her paid for the amount she's owed, so she can continue to work. That's what I was gonna recommend, but I hadn't had any contact with her. I wanted to break it up into different agreements so that it falls within our procurement manual, because even though the resolution says procurement manual has been waived with regard to her payment, it's being held by the finance monitors. So I don't have those copies.
Do you have a copy of that, Chairman?
I don't.
Did we get those back up, or?
I'm not sure if we did or not.
Scott, maybe we get the court administrator involved, because I just received a message that Aisha has quit and withdrawn from her cases, but we do owe her those past invoices.
So all we have is a motion to pay her for the amount, the balance that she's owed, right?
Well, we just need to visit with Cheryl because finance wouldn't pay it without a resolution, so I don't know what we need the council to.
They just need to be directed to honor it. There is, I think there was one passed. No, there hasn't?
It was, motion was withdrawn by Lisa until negotiation is done.
So is there, I guess, sorry, Chairman. So can we have Myrna come in here and ask if she will honor us just making a motion to pay her past dues invoices that we have in place, and then have, I don't know, somebody negotiate her contract or whatever.
I don't think we need her in here. I think we can just make that motion, and by motion, she'll have to do it, so.
All right, well, I'll make that motion to have finance pay Aisha Carr's past due invoices and current invoices that she has and needs to be paid.
Okay, second by Darrell. Go ahead, Eric.
I was gonna say, why don't you add to your motion that you'll do it by resolution and that you waive the procurement policy because we do that all the time for sole source acquisitions. This is kind of like a sole source acquisition that because of the uniqueness of the services that you waive the policy limits on the procurement manual.
Did you get that, Kim?
Just waive the procurement. My resolution, and I can do the resolution.
Are they gonna pass the resolution today, or how are they gonna do that? Are they gonna wait till next meeting?
Bring it up at the next meeting. Well, at least the motion will authorize payment.
Yeah.
Okay. I don't understand how you can do a payment in the resolution after.
The payment's already been submitted, it's just being refused by finance.
To waive the procurement for Alicia Carr's payment?
And the motion should be sufficient enough that's followed up by a resolution.
You would think, yeah.
That's why I was saying to have Myrna come in here, because maybe she can explain why they're not honoring the previous resolution.
We can have her come in here, but we'll have Sarge go get her.
So to waive the procurement for Alicia Carr's payment for invoices that are past due, or invoices that are due.
Because I think those are done by court order. She was hired.
Call Rogers and see what her problem was with getting her paid.
Yeah, we're bringing Myrna in, so she'll answer that. Vanessa, did you have a question earlier?
Yeah, I just wanted to know if you did that follow-up with Mr. LaPointe.
I didn't get a chance to do that, Vanessa, okay? We didn't get out here till 6:30 and we started this morning, so.
But when will that be done? By Friday, or you know if we
I
can
told Phil today that we would do a follow-up and we can get a meeting with Tim LaPointe by tomorrow. We'll get that done.
All right, thank you.
Okay. Okay, we need to take a little 10-minute break.
Yes.
Okay, let's take a break here and then we'll finish up. You guys got all notice that we're releasing at 1 o'clock, so. Yeah.
It's 44.
Let's go fill out one.
Cleared up, look at that.
I know.
There.
Oh, there's our lunch. We're gonna eat before we go home.
There it is.
Oh, there it is, it's spiked out.
Yeah, Fremont, will you go ahead and give a milk parrot, because we're gonna have a working lunch here, so.
Kasila, akatnaka, lewana, witoka hieko, lewana, buitea higro, kelana, kasila, ukichi ostena, which was on him, stay, unichila, and I am petuki, and I ushia hoa, hold me taku.
What is this?
Got a number already, 24. Those are contracts.
Motion for emergency legislation. Or did this get a number?
82, I think.
Same one as that 44?
Yeah, well, it's just the same one as that 44 that we, tabled. We already
That we
gave-
tabled?
Yeah, it's the same thing.
So, did we table on the emergency legislation or table on
Yeah,
the?
we gave it a number and then we tabled it, for negotiations, but we'll pass this one back out. We'll just bring it back out, reconsider and,
But it's 44?
yeah.
Squats today.
Basically, it's approving her contract. That's what it's doing. It's not fluid payment from what she had already worked. It's approving her contract.
She still want a contract with us?
I don't know.
I think the reason why we did this was because on that, therefore be it resolved, pursue a contract for a period of 3 years. I think that was the holdup, was that 3 years.
There was an issue with that, and the hourly rate and the mileage rate was set at $1.
But we don't have no problem with it now. Is that what we did?
I think we should pay for those past invoices and then negotiate her contract if she's willing to come back to work.
I think we're looking for a contract approving her, for payment, a resolution for payment, but this is something whole different. It's approving her contract.
So, on this contract though, what's the issue with the period, with the term? You want it for a shorter period? For 1 year or 2 years, or what was the discussion? I wasn't present.
I think in our discussion, sorry, Chairman, I'm trying to find Judge Marshall's email. I think in our discussion, we talked about how long they have their contracts for, their special contracts. Has it always been 3 years, or has it been 1 year, 2 years? What's been the norm for these special contracts like this?
For the attorneys that are employed with the court, they are on 2-year contracts, and that's what hers is set at. But if she's just a court-appointed attorney with that 3-year contract, is she essentially a court employee now? That was one of the questions. And then the other one was the rate. I think Tennille brought up a question on the rate, and then the dollar mileage per rate, where she'd be getting more for the tribal employees.
She's pretty cheap. Considering the other attorneys we did.
Well, if it's a, Mr. Chair.
Yeah, go ahead.
If it's a special, appointed, or special public defender, she could be appointed during that term, but she wouldn't be continuously employed. And I think that's kind of a similar contract they have for a judge, for example. They wouldn't have, they could be appointed to different cases, but they wouldn't be continuously employed. They could just be appointed as needed. So maybe that could be added to that resolution, that they're appointed as needed during that 3-year term. Would that be a reasonable compromise, Lisa?
Can you repeat that?
I suggested that she act as a, by appointment of the court, as special public defender as needed during that 3-year term, rather than a continuous employment during that 3-year term.
I don't know. They got some down here. I guess they're letting out schools, so.
I wanna, I don't know if you guys can pull it up on your phone or your email, but Judge Marshall sent a letter to Eric, it looks like. And it says pursuant to second amended court rule 17-05, the current rate is $100 per hour for representing
They're calling in
indigent
their concerns,
defendants
so we
at
better-
all court appearances and all aspects of the case. This does not include attorney's travel time. Travel is paid at $1 per mile. This amount includes the mileage for the use of the vehicle and the attorney's travel time to and from the Rosebud Sioux Tribal Court from the attorney's home or business address. The current federal mileage rate is 65.5 cents per mile, so the attorney would be getting 34.5 cents for their time, which would equal the $1 for travel.
Okay, all right.
And then it goes on to say, it should be noted that compensation for court-appointed attorneys in the state of South Dakota is currently $107 per hour. Travel is paid at the rate of $1 per hour for both the use of the attorney's vehicle and for their travel time. So that falls into place, but $1 per mile. Just like what her contract says. The compensation rate of $100 per hour and $1 for travel is reasonable and necessary to provide representation for indigent defendants in the Rosebud Sioux Tribal Court.
Yes, they gave admin at noon. Huh? They gave admin at noon. Yeah. Oh, okay, I got here. Yeah, they gave admin.
Okay, is there amendments in there then?
Only question that I have is that 3-year thing, is that supposed to, I mean, is that a normal? That was the only thing I have. I don't know.
They all have different ones, don't they? Are they supposed to coincide with the terms of office
The
or?
Constitution says the chief judge can get a contract no less than, I think, 5 or 6 years. So it's whatever term you want to assign to him. But if this is just a special public defender, then they could be appointed to cases during that term. And I think that's probably what we need to add to that resolution if you want to amend it. Because she wouldn't be a continuous employee, she would just be appointed to represent in its indigent criminal defendants as needed if there's a conflict with the regular public defender. And I think that's what the intent of the resolution is supposed to be. I didn't draft it, but that's what I would suggest we add to it.
Okay, so what is her dollar amount of her past due invoices?
I don't know exactly, but if you want to include in our additional whereas to authorize payment under this resolution for past due amounts owed, for whatever period of time it's owed, I can get that number inserted too. Like I said, I don't have all the information. That's one of the difficulties I've experienced trying to negotiate what she owes, is because I don't have the information.
Scott, can we be on air for this financial talk?
We are on the air.
I know, can we? Is it okay for?
Probably
financial?
not. We'll just go off. Go off, Calvin. Thank you.
After we already spent the goods.